Hello, I'm Andrea Fava from Johns Hopkins University, coming to you from ACR in Chicago. I want to discuss today about the importance of addressing lupus nephritis early. There was a beautiful plenary session by Michel Petri coming from the Accelerating Medicines Partnership group that showed that if we biopsy lupus patients when they have a proteinuria above 0.5, which is the agreed threshold, it may be too late. Biopsying at 0.25 was already able to identify 71% of lupus nephritis patients, and 56% of all these patients had actionable lupus nephritis. If we identify nephritis early, we can intervene early, and there is a much lesser fire to put out. So think about biopsying patient at 0.25 grams. You're going to find lupus nephritis early is going to make your life easier. The other is point that will go in this direction is that there was data presented by Brett Rovin that showed if you wait for proteinuria to be too high, 2-3 grams and more, it's going to take much longer to obtain a response. And we do know that having a high proteinuria at baseline and a delayed response is associated with a higher risk of loss of kidney function, which is what exactly we want to prevent in lupus nephritis. The other point about catching and addressing lupus nephritis early is that if we can get patients into remission early, and if we can show that even the biomarkers that identify inflammation in the kidney can go down as early as 3 months, that early response is associated with a much lower risk of permanent loss of kidney function in the next 5 years. So the operative word is early. And so catch lupus nephritis early, address it aggressively, and we're going to improve outcome for lupus nephritis. If you want to learn more, go in the room now.